Here is how I approach carpal tunnel syndrome in my patients. So first and foremost, I try to first evaluate what the symptoms are. So typically carpal tunnel syndrome symptoms are the following. You often will early on have tingling in the thumb, index, middle, and part of the ring finger here. That's what's called the median nerve distribution. That's where sensation from those areas accumulated into the median nerve, which then goes right through the carpal tunnel, right in the base of your palm here is where the carpal tunnel is. And then it goes up through your forearm and back up all the way up to your neck and to your brain. That's how the signals are kind of transmitted. And so when you have problems at the carpal tunnel where things get tight, the symptoms you start to feel are in that distribution. You also can, in more advanced symptoms, get weakness in the muscle because part of that nerve also is responsible for driving the muscle in the base of your thumb. So sometimes if you get that kind of meat of your thumb here, if you get like a flattening or thinning out of that muscle, you start to suspect possibly there's some carpal tunnel syndrome going on where the signals aren't getting to the muscle to drive the motor response, which is basically thumb opposition, which allows you to kind of bring your thumb and curve it around and touch the pinky and other fingers and kind of get it out of your palm here. So that's the function of the median nerve. And because the median nerve goes through the carpal tunnel is sort of oriented going from your forearm into your palm. Inside that carpal tunnel, there are 9 tendons and 1 nerve, the median nerve, and the tissue around the flexor tendons, which are responsible for flexing all your fingers and your thumb, is called flexor tenosynovium. Now that tissue, with repetitive use and maybe other conditions like diabetes, maybe amyloidosis, can start to increase pressure inside that tunnel. Now that tunnel doesn't stretch. As pressure goes up, it just starts to squeeze the nerve more. And that's when your symptoms start to come about. So there are physical exam tests that I do, whether it's tapping, squeezing, bending, that can elicit or exacerbate those symptoms. And those exam findings can actually help me towards achieving even just a diagnosis on physical exam and history alone. When I've confirmed a diagnosis of carpal tunnel, here's how I like to approach it. When symptoms are just, you could feel things normally, you can, do buttons, you can deal with like earrings and, jewelry and small like coins. That means that your sensation is normal and it's really just more of a tingling, burning type of symptom. And that's usually on the milder end of symptoms. And in those cases, oftentimes bracing at nighttime, rest, maybe some supplements. There's some literature that suggests that B vitamins can help, but other than that, I do often recommend a single cortisone injection. That can help acutely decrease inflammation and pressure inside the carpal tunnel, and it can make those symptoms often go away. Now, sometimes that can cure it, sometimes it comes back, but we wait and see how you respond to that. There is some studies that suggest Shockwave can actually help carpal tunnel syndrome symptoms, again, by addressing inflammation directly. So that's a series of 3 sessions of extracorporeal shockwave treatments. And at the end of the road, if your symptoms keep coming back, then a carpal tunnel release likely will be a cure for your symptoms. What is a carpal tunnel release procedure? Well, I personally do one of 2 procedures. I do both, and it depends on the scenario, but people who have more progressive symptoms or more severe symptoms where not only are you feeling numbness, burning, maybe waking up at night with pain in that sort of median nerve distribution, but also maybe you're numb. You literally can't feel things. You can't discriminate between like this object or the textures between this. Maybe even you might burn your fingers because your sensation's not protective. That means you have much more severe symptoms. In that case, the nerve has been distressed for a very long time likely, and I tend to do those carpal tunnel releases open. What that means is I make an incision in the palm, kind of like right here in the middle of the base of your palm from about here to here, and I go straight down. I go down to what's called the transverse carpal ligament. It's the roof of the carpal tunnel, and I simply release it. And I also make sure that everything's released around it and around the nerve that I can visualize. Oftentimes we'll see it as like an hourglass configuration, as we can see right where it's been squeezed, and right away you can see blood flow kind of just open up a little bit around the nerve, but it still may take time. And I tell my patients who have open carpal tunnel release because they have severe symptoms, when they've lost sensation, your nerve pain related symptoms will go away almost immediately. The ability to feel if you've lost it can take many months and up to a year to get to your final result, which isn't even guaranteed to get you to normal. It's still worth it to go through the procedure because it will likely improve. So that's when I use the open procedure. Now, I also do endoscopic carpal tunnel releases. Now, what is that? That's by doing the procedure, same idea, we're releasing the transverse carpal ligament underneath the skin, but instead of doing it from the top down, we are doing it through the bottom up. And so what I do is I introduce through a little incision still, but smaller, offset. I do it in the palm, some will do it in the wrist crease, but we get under the tunnel, and then we look up with a scope. We can see the fibers crossing above us, making sure that there's nothing in the way, no nerve, no tendon, nothing. And once we see those transverse fibers, we can take a small blade and we release it from within. And so by doing that, that allows us to release the entire carpal tunnel without making a big open incision. Now, the reality is doing it either way tends to be, as long as you safely release the nerve and release the pressure on the transverse carpal ligament in the carpal tunnel, your results will be great. The only difference that's been ever really shown between endoscopic carpal tunnel releases and open carpal tunnel releases is a slightly decreased amount of pain early on in the first several weeks. After that, the results tend to be the same. So, for milder symptoms, I will tend to suggest a endoscopic carpal tunnel, smaller incision, a little bit of a quicker healing process. So that is my general approach to carpal tunnel syndrome. If you have any comments or questions about the content you just watched in this video, leave your questions below in the comments. We're here to help.